And
Hello, my name is Wesley Fields, and thank you for taking a few minutes to learn more about Epi Medical's product, HYBENX. So HYBENX brings a new technology to the dental industry that quickly changes the oral environment from an infected state to a healing state. This new technology is desiccation shock technology, or as we refer to it as DST. And regarding periodontal treatment, as you can see on this slide, HYBENX is the first product that can halt the advancement of periodontal disease by eliminating harmful bacteria in seconds. Quick method of action. So all microorganisms are dependent upon water to survive. And HYBENX produces an electrostatic charge that attracts water. This action desiccates the microbial biofilm in seconds. And what's left is all bacteria and viruses are dehydrated and dead, and a coagulum of devitalized tissue is formed. Now the natural healing processes of our bodies are accelerated. So HYBENX features and benefits. Application takes seconds, FDA cleared for multiple dental procedures, safe on dentin enamel, porcelain, titanium, and other metals, no post-procedure patient instructions. 2 viscosity choices. We have a gel and a liquid. They are clinically the same. It's truly a procedure and clinician preference and very competitively priced. Benefits: eradicates bacteria in seconds, inhibits infectious and inflammatory disease processes, single treatment transition from infected to healing state. Desensitizes, does this by sealing the nerve endings in the soft tissue so that post-SRP discomfort is greatly eliminated, not completely removed. Immediate hemostatic properties and no bacterial resistance. This is a big one because the functionality between how HYBENX works versus, say, antibiotics and other similar products, they function by suppressing replication of the bacteria and then allowing the body time to hopefully come in and combat and eventually defeat that bacteria, whereas HYBENX actually kills and removes that bacteria within a single treatment. Here's a quick product comparison chart, and as you can see, handful of similar products, but none of them do everything that HYBENX does. And again, HYBENX does this in seconds, not minutes, days, weeks. Let's talk about a typical advanced treatment case for advanced periodontal disease. So here we have a fairly aggressive and advanced case. So what we're going to do is we're going to treat that calculus buildup super gingerly first. So we're going to apply HYBENX along that calculus buildup, let it sit for 30 seconds, evacuate and rinse. In that 30 seconds, the HYBENX has dehydrated both the calculus and the biofilm, which is allowing the attachment of that calculus to the tooth structure, which helps ease the removal of that calculus. Now you're going to do your scaling and root planing. Post scaling and root planing, do your best job in drying the pocket. Now we're going to go subgingivally with HYBENX. We're going to place it, let it sit for 30 seconds. Again, evacuate and rinse. And now in that last treatment, we've now taken and actually changed the environment within that perio pocket from an infected state to a healing state. So HYBENX has literally killed the bacteria, calmed the inflammation, and helped to remove the dead tissue and debris, which is the food itself actually for the bacteria. How about implant maintenance? So on your typical hygiene visits, as you see the implants, there can be obviously the calculus buildup or sometimes that dark colored goo that forms around the implant itself. HYBENX is fantastic again at easing the removal of the calculus buildup, and as well as that dark goo that can sometimes be there because of how it functions. That dehydration effect makes it much easier to remove, especially as you're using those plastic instruments to be safe around the titanium implants. Here's a huge one: peri-implantitis, second most common complication in implant therapy. So again, HYBENX is a fantastic solution here. So you go in, you place the HYBENX in and around the implant. It flows down and around and through the infected areas. And again, within 30 seconds, it has killed and removed the cause of that peri-implantitis, the bacteria. Here's something you probably see on a fairly regular basis if you're doing hygiene visits, right? It's fairly aggressive gingivitis. So how can we help this patient help them prevent themselves from progressing from gingivitis to periodontal disease? Well, let's go in and let's treat it with HYBENX. All right, so this is an opportunity for you to be able to provide a true benefit for your patient and prevention from them from moving forward to a disease state and allowing yourselves additional revenue opportunities in the hygiene department. If you have any additional questions, please reach out via phone or email, and we look forward to hearing from you. Thank you for your time today.